Now let's see a case where the anesthesiologist is now acting for the patient's care by performing his post-operative pain management. So for example, he is going to do a block, say a femoral block. A patient has underwent a surgery, and then as a post-operative measure, he is taking care and he is providing this femoral block. Now the question is, when you report this block to the insurance company, what happens is this gets denied. Because we all know, like we have this global surgical package which includes all the post-operative pain management. But here what has happened is, the anesthesiologist is performing it. That's the difference. If the pain management is being done by the surgeon, then it is no longer reported because it is bundled with the global payment. Here, the surgeon is requesting the anesthesiologist to take care of this patient. So here in this case, what we can do is like, we can report the block code for the femoral nerve that is being sedated. You can report that with a modified 59 to show that the service is distinguished and is being done by the anesthesiologist and not by the surgeon. Another thing is, we need to know two things. One is, what is a primary route of anesthesia, or what exactly is the route of anesthesia? Because whenever we say the route of anesthesia, what we are thinking is, what is the type of anesthesia? Like, is it general, it is MAC, or it is spinal, or it is epidural, or is it like regional? So whenever the physician is performing or giving a general or a MAC as a primary type of anesthesia, and when he is also doing a post-operative pain management, you should consider certain things. First thing is, you should know what is a primary anesthesia that has been instituted and what is a type of management that is being done as a post-op pain management. For example, the patient is undergoing gastrectomy and he is being subject to a general anesthesia. And later on, if the patient is also given a post-operative pain block by the anesthesiologist, here we can report both the anesthesiology for the gastrectomy service and secondly for the post-op pain management, because the types of anesthesia here are different. Whereas, imagine a procedure, say for example a total knee arthroplasty that is being done with a peripheral block. And as a post-operative management, the physician is giving again a femoral block or a spinal block. Here, we should not report this block separately because already the primary procedure itself had the same regional block. So I hope you understand. You should know the types of anesthesia in the first place and then in the post-op pain management. If the same spinal is also given as primary and again as a post-op also if the same type of regional block is given, this will not be a billable service by the insurance company.